but we add dextrose to our fluids to maintain the blood sugar levels. This is because insulin is needed to stop that scary cycle that we talked about earlier of the breakdowns of protein and fat that is causing the acidosis. But we don't want them to get hypoglycemic because, again, hypoglycemia can be fatal. So we add dextrose to their fluids to still feed their cells. Once they are not in DKA, we treat them like a regular diabetic and we start them on the insulin of choice twice a day. The prognosis for an uncomplicated diabetic is not bad as long as you have a dedicated client. There is a big financial investment at the beginning of treatment and for the rest of the patient's life, honestly. The owner must be committed to give insulin injections twice a day for the patient's life. The prognosis for DKA is fair to guarded depending on the severity when the patient first gets to the hospital. This treatment is expensive. Always make sure that your client understands that their pet will need insulin injections twice a day when they leave the hospital. I have met clients that have just spent $3,000 to get their pet out of DKA and are horrified to hear that they have to give their animal shots because they can't give their animal shots. Things that are no-brainers for us working in veterinary medicine, they're not always obvious to our clients. Long term, we are talking about glucose curves weekly until the patient is controlled. Then we do glucose curves or fructosamine levels, regular urine cultures, regular dentals every 3 to 6 months, depending on how our patient stays regulated. This all costs a lot of money. These pets will also decompensate quickly with a minor illness. If they stop eating for any reason, they can end up in the hospital and they can end up back in DKA. If the clients aren't proactive and really observant, these guys tank very quickly. So when that happens, that's in my experience when most of these patients are euthanized. They try at the beginning, they get them out of DKA, they get them regulated, but then they decompensate and they're in DKA again and the clients just say, I can't do this again. So again, we have a really good quality of life if we have owners that are well educated and willing to invest the time and the money into caring for these pets. And you will meet owners that are super dedicated and will do anything you tell them to. And then you will meet owners that try to cut corners anywhere they can. Unfortunately, you can't get a well-regulated diabetic when you cut corners, but there are things like teaching an owner to do a glucose curve at home or check blood sugar at home that can help reduce some of the cost for the client. But we really have to do those routine, regular urine cultures, routine dentals, minimize any inflammation or infection in these patients to keep them as well regulated as possible. We have to take every opportunity we can to educate the clients about the importance of this routine care once we have a diabetic patient in our care. Thanks.